Hi Marcia.
Hi Dr.
How are
Newman.
you?
It's good to see you again.
Same here. What brings you in today?
Well, I've been thinking for quite a while now. You know, I can't stop the years from advancing, but they seem to be showing up on my face in the terms of it going down south. If there's anything that you could recommend to kind of slow the process a little bit.
We have a lot of tools now. We can do from traditional surgery of, cutting and pulling on the skin to do a facelift, to non-invasive treatments completely, where we can heat up the tissues and cause them to tighten up and smooth out the skin. If we were to do a traditional facelift where we would cut and pull on the skin, the area where it concerns you in the jowls will look more prominent. And it won't do anything for the cheek area or the eye area, so it doesn't address those areas. If we go to the least aggressive treatments where you have zero downtime, non-invasive, there's lasers, there's radiofrequency devices where we can treat from the outside of the skin to improve some of the lines, to improve the looseness of the skin, the elasticity, to tighten it up, but it has to be repeated more than one time to give you the ultimate result that we would be happy with.
I see.
And there's things in between. I think if we can tighten the skin here and reduce some of the fat pocket here, it would give it more balance to the lower face to the upper face. You have asymmetry from one side of the face to the other. This side is a little bit bigger than this side, is a little bit fuller. One of the latest technologies that's come out is Thermi Rf and Thermi Tight. They're basically radiofrequency devices that will heat up the tissues and cause the skin to contract. All these deep lines will get smoother around the mouth, around the eyes, on the cheeks, and it will give you a little bit of a lift. We can combine that with Thermi Rf, where we go underneath the skin and heat up the tissues and melt some of this fat so that it will give you a more balanced look from the top down. Basically, we numb the area.
Yes.
And then we put a probe underneath the skin through like a needle mark.
I see.
And it just heats it and it will tighten the skin. There is a little bit of swelling because we're numbing it and we're heating it in the inside. There's a risk for bruising, but usually most people don't bruise with it. And it's going to be a little bit sore for a few days. We can take Platelet Rich Plasma, which is you take the blood, you separate out the platelets, and then you inject the platelets into the skin. Those platelets produce growth factors. The growth factors stimulate the healing process and the stem cells. So by combining these two, you get a much better result in terms of the skin outcome and in terms of the rejuvenation effect.
What would the frequency be then?
So the Thermi Tight is non-invasive. There's zero downtime, there's no needles, there's no redness. You do it and you walk out. On average, most people who do Thermi Tight, they need 3 treatments 1 month apart.
With the various procedures that you recommended, can that all be done in one day?
Absolutely. All the 3 procedures can be done within 2 hours. The Thermi Tight, the Thermi Rf, and the PRP will be all done in the same day, but the Thermi Tight, which is the non-invasive portion, may have to be repeated in a month or 2 to get the optimal result.
I would like to do this, definitely.
Great.
Thank you.